a very untapped into market that's happening is going to be your sandwich generation individuals. Millennials who are taking care of their parents and their children at the same time as building their quote unquote wealth, their core working years. Hey, I am Jamela. I'm the social services maven, and I speak about trends in health and human services, specifically for entry level case managers. So, you will see more individuals coming in seeking services for system navigation, which means how do I use my insurance to get my needs met for my family member? Last month, Medicare came out with a fiscal year projection that they will begin to cut the cost of home health services by 30%. So people are still going to have to heal. They're still going to get sick. They're still going to be in and out of the hospital. They're still going to have to be taken care of. And if they're not being taken care of at home, where are they going to be taken care of at? We're going to use those linguistics here, at. So the sandwich generation, they are going to be put off into their family's home. Or, they're going to be placed off into long-term care. And the government is going to begin funding long-term care, boarding cares for more services. Because why? One, a lot of time individuals who are getting health home services are getting them because of preventable disease, diabetes, health issues, and possibly COPD, which you see in a lot of poor Black and brown neighborhoods. And the government doesn't like to pay for that. They see it as a lifestyle choice. That's the first thing, the first diagnosis. But two, the individuals that did not get the COVID vaccine, they will not cover that anymore under your insurance because COVID is perceived as a preventive disease now. So what that says is there are some long-term impacts connected to COVID that the government has already been able to see. And they know that that is going to be coming. And they know that people are going to start getting ill again, which we are seeing now in the rates of COVID beginning to go up. The feds have already responded to it where we're going to cut health and human services. So systems navigation, systems advocacy is going to be a new need. And that's going to be possibly your registered nurse case managers, which means you have to have an RN licensure to do that, your clinical social workers, but then it's going to have to be your navigators, your non-clinical team. That non-clinical team is going to be the team that is going to be acquiring information, is going to be assisting with the auxiliary things that happen in services, which is housing, which is transportation, which is Medicare D recertifications, or if you need to get A or C, that has the long-term care. And then the family. So how is the child who's part of that sandwich generation, they're going to have to off-put their responsibility to someone else because you cannot raise two different generations at the same time. You're going to see an uptick in depression from them, which is millennial individuals. You're going to see an increase in depression. You're going to see an increase in anxiety. So the new jobs are non-clinical case management because of the cut in insurance. So this is a video that I want you all to begin looking through the lens of Medicare and where health is being cut. So if health is being cut, human services is going to have to go up. And as I said in that Deloitte video, I don't know when I'll put it up there, go and look at the Deloitte video about eligibility workers and stuff. Those are the new jobs, y'all. Eligibility workers in healthcare system navigation is the new job. You are helping the sandwich generation child with the parent and the possibility of the child, if the child has autism, if they have a disease to